guys, welcome back to my channel. Today we're going to do a video about what to expect as an EMT student. I've been wanting to do this for a while, but I wanted to be far along in the program that I could tell you not like enough about it, not just be like, day one, this is what it's like to be an EMT student. I can definitely document my journey as I go further along, and then when I finish the EMT program. I am in Texas, and I decided to go with the program called RC Health Services. They have a couple around Texas, and I believe it's nationwide, but what I struggled with, especially during this time, is do I do it in person? And do I have an instructor, or do I do it online? I am a very visual person and I learn more hands-on, so I was like, okay, cool. Am I gonna like learn all of this stuff online? But one thing that was reassuring is that all of the skills portions, all of the things that you would have to do physically as an EMT, that's in person. So I knew I was going to be tested on that, and I knew I liked the ability to study at my own pace. So that's what I did. When you look up how long it takes to be an EMT, it usually says around 6 months, and that's what this program gives you. Like if you do it online or if you do it in person, it gives you 6 months to do it. Usually gives you a guideline. Okay, this is how long it's going to take to do the didactic portion, and then this is how long it takes to do the skills portion, and then all of the testing, and then at the event, and then eventually at the oh my gosh, and then eventually at the end when you take your NREMT, which is the National Registry EMT exam that you have to take to be certified and to go ahead and find a job as an EMT-basic. So I'm going to kind of take you through all of the steps that you have to go through as an EMT student. I am glad I did the EMT online, even though I probably would have retained things better, you know, having an instructor telling it to me. I definitely got through the program a lot faster on my own, just because I got laid off from my job, so I had all the time in the world just to study. But we're gonna kind of go through, you know, what you start out with. So you have the didactic portion first, and with this program, you have 41 chapters. So once you finish all of the learning for the program, you kind of hit certain milestones, and that's when you have your skills. So I'm gonna go a little bit into that. I'm sure every program is different, but this is specifically for this program. So you would have chapter 1 through chapter 23, and then you would take something called a medical exam, and then you would have your medical skills testing day. For the medical exam, I had to go through airway management, principles of pharmacology, shock, respiratory emergencies, cardiovascular emergencies, neurological emergencies, and then once I took that medical exam, obviously you have to pass it, then you go in for your medical skills day. This is everything that you would have to do on hand, and you kind of apply obviously what you learn to that skills day, but one of the cool things that they give you is videos along with it. For example, bronchodilator. I was like, I do not have these things at home clearly. How am I supposed to practice it before this skills day? So they give you a bunch of videos. We practiced 1, 2, 3, 4, 5, 6, 7 things. They show you more videos and more things that you have to learn, but you're not necessarily tested on for your skills testing day. One of the things that you are tested on, so there was really no guideline as to what to expect. I'm thinking, okay, I have all of these skills, and it also comes with a skills sheet, like the grading sheet, so you know exactly what they're looking for and how you're going to be graded on it. So I was like, are we supposed to already have this practice? And then I go in and you're like, okay, in front of the whole class, you have to do this skill now. So it was very scary. But basically, you just went in, you watched the video, you got into groups, everyone had their mask on, and you kind of tested all of these skills on each other. So there was no testing as of yet, but it was kind of nice having a once through of touching all of the materials and actually, you know, using your stethoscope to auscultate someone's chest and understanding what you need to do with it to actually hear their lung sounds. But okay, so one of the skills you had to do for medical skills day is vital signs. And then you're obviously gonna take this with you throughout your whole journey as an EMT. But vital signs would include someone's pulse. So you would learn how to take someone's radial pulse, and then you were gonna take blood pressure. And then I just got these off of Amazon, but you get a stethoscope and you have to buy your own blood pressure cuff. But I wanted the blue one just because I love blue. It has your little reader. And then I just practiced this on a bunch of people, and it was kind of interesting to see where people's blood pressure like arrests. We had someone in our group that had hypertension, so I knew that I had to squeeze a while before I stopped hearing the heart rate. But you learn how to use your blood pressure cuff and find the pulse manually. Is that the right way to do it? Like, you're able to palpate the pulse, and you also learn how to use your stethoscope along with your blood pressure cuff. I think it's obviously a skill that everyone needs to learn nowadays. You kind of just put your arm in some machine and you press the button and then it tells you what it is. But especially in the field, I'm sure I'm gonna be lugging around my stethoscope and my blood pressure cuff. You practice it so many times that it almost becomes second nature. And you have like homework exercises to where you have to, go to 10 different people on different days and take their blood pressure and their pulse and get their respiratory rate, anything that includes vital signs, so that you really are tested well on it. We are in Corona, and we were during the pandemic, and we are still like in quarantine, so they allowed us to do it on in person, so I did it on my girlfriend for 10 days. I'm sure that was fun. The new Ariana Grande album just came out, and there are definitely a couple of bops on the album that are like stuck in my head. So please forgive my humming if it does happen. And then, okay, so a big one that you learn is patient assessment. Now this is something that you use when you are on an ambulance, or even honestly if you're in the hospital and you meet a patient for the first time. Literally what you need to do once you get off of that ambulance to dropping your patient off at the hospital. You need to know this by heart, and obviously you go over it a lot of times, but I don't know if you can see that. What you do with this patient assessment, it's medical versus trauma. So medical would be something more along the lines of nature of illness. So someone having a heart attack, someone having symptoms of diabetes or a stroke, versus trauma, which would be, falling off a ladder or getting into a motor vehicle accident, or, getting stabbed or getting shot at. You have different ways that you're gonna assess those patients. So medical assessment is going to be different from trauma assessment. The way that you're tested on it is they kind of give you a scenario. They say, you're dispatched to a 56-year-old male who's presenting with this, this, and this. And then you go through this patient assessment, and through kind of like a little bit of detective work and asking the right questions, you figure out what might be possibly wrong with them. Obviously, it's not your job to diagnose, but it's so interesting to now have the tools to even attempt to be like, okay, I believe this person is having an acute myocardial infarction, or I believe that, this is an exacerbation of their angina, or, this person is hypoglycemic or hyperglycemic. So I thought it's really cool to be able to have the tools to go through this. Okay, moving on. You do a bronchodilator skill, BVM, which is that big mask that you see EMTs use to help ventilate a patient. You do oxygen administration via a non-rebreather mask, which is basically that tiny mask that goes on a patient's face that they then, just put on the head. And then cardiac arrest management, which is just CPR, AED, and then epinephrine auto-injector, so if someone's having an allergic reaction or anaphylactic shock. So you go in for your medical skills day and you do all of these skills. Then that's complete. Now, you're not tested on these skills that day. However, retain the information, go over it a couple times at home with the videos, and then you're gonna be tested on it. Then you have your trauma exam. So you have chapter 24 through 31, and then you have your trauma exam. And this includes bleeding, soft tissue injuries, face and neck injuries, head and spine, chest, abdominal, orthopedic injuries. So stuff that you would see obviously in trauma cases. You have your trauma exam. These for me were online. You pass them. And then you go in for your trauma skills day. And this includes, let's see, I gotta find it. Okay, let's go all the way down to trauma skills day. And these are completely different skills compared to medical. Then you have patient assessment trauma. And the same way that they test you with that is you're dispatched to a 24-year-old female who was in a motor vehicle accident and was thrown off her bike and has some kind of leg deformity. What are you gonna do with that? You have bleeding control and shock management. So if someone's bleeding excessively and you can't get it to stop, how to apply a tourniquet. And then a major part of the trauma skills is immobilization. Remington, come here. You can't bark when mommy's talking, okay? Do you want to say hi? You're such a good boy. But as I was saying, a huge part of the trauma skills day is immobilization and learning how, to wrap a certain joint or a certain injury and how to be mindful of someone's spine, because most of the time whenever you're dispatched to a trauma emergency, like one of the first things you're going to think about is someone's spine and putting on that seat collar and making sure that no one disturbs it and nothing, no further injury is added to the already injured spine. So you're going to joint immobilization of the wrist, of the knee, hip, ankle, elbow, long bone immobilization, clavicle, humerus, tib, fib, so your lower leg. A traction splint, you usually do this with femur fractures. And then seated spinal immobilization, a supine spinal immobilization. Supine just means laying down face up and basically just putting them on a backboard. Oh, do all this talking. Okay, so for my testing day, I was tested on supine spinal immobilization, but I never actually practiced it. So that was an interesting experience. Okay, so you have your trauma exam, trauma skills day. Then you finish the rest of the chapters, which includes environmental emergencies, obstetrics and neonatal care, pediatric emergencies, geriatric emergencies, patients with special challenges, incident management, team approach to healthcare. So basically other things that are included with what you learn as an EMT. Then you have your first official testing other than just online. Sorry, my dog is drinking and eating his dinner. Remington. Oh my goodness, thirsty boy. Then you have your first skills testing day. So everything that you went through on your medical skills day and your trauma skills day, you are now tested on, which is super exciting and nerve-wracking. So basically I went in and there's 6 or 7 people there. Yes, I love you too. And she comes in and it was kind of like a 9 to 5 thing, but I think we were let out 2 or 3. But she was like, who wants to go first? And I was like, I guess I'll go first. And then she was like, okay, 2nd, 3rd, 4th, 5th, 6th. This is gonna be the order for the whole entire day for every single skill. And I was like, did I just shoot myself in the foot? Because obviously the first person is the guinea pig and then they come back and they're like, you're gonna die, or it was fine. Anyway, so we're tested now on these skills. There's no practicing, you don't get to see anything beforehand, you don't take anything with you. You go into a separate room, they present you with the scenario or the skill and you're tested and you either pass or you fail. There is no in between. Now, I think you're tested on 9 different skills for this program. You can, I think it was fail up to 3 of them. You retest them later anyway, so it's not like you can fail and continue. You have to pass that failed skill. But you fail 3 for the day and you pass for the day, but if you fail more than 3, then you fail everything and you have to come back another day. But if you fail a singular skill, you can usually make it up later that day. Now, I went first, and patient assessment, medical versus trauma, as we went over, is different. You kind of ask different things. You have a different order of things you ask or procedures or an order that you go through with your patient. I walked in thinking it was medical assessment. You have this little whiteboard. You kind of learn little acronyms to remember what you need to ask. I'm writing all this on the whiteboard. She goes, okay, I'm presenting you with a trauma skill. And I was like, excuse me. So I wiped up everything back off of the whiteboard, and then I put my trauma skill acronyms down, what I need to ask. And then she presented the scenario to me. I think it was, this was a couple weeks ago, but it was like a 57-year-old male who was shot in the chest. And I'm nervous as all heck. And you know, I have my mask on, so it's like hot and I can't breathe. And I'm like, does she hear me? And am I gonna ask the right questions? What if I fail? And so she's telling me all these things that are wrong with this patient. He ended up having a tension pneumothorax, and I somewhat knew how to like deal with that, but also he had so many other things going on that I ended up missing a treatment and I failed the skill. I was like, are you serious? Like, I studied so much, but I was just so in my head that I missed a treatment. And if it was anything else, she would have passed me, but this was like such a significant treatment that the patient could have ended up dying. But you know what? I'm glad that I was failed, because now I will never forget what to do if I ever come across a patient that was shot in the chest and that ended up having a tension pneumothorax, and to put a dang occlusive dressing on his wound. I will never forget that now. However, I passed everything else, and at the end of the day when everyone left, I did it again. She gave me a different scenario. She even told me beforehand that my process was beautiful, and I did amazing with everything else, just because it was such an important treatment. Like, that was literally a fail or pass thing that she failed me. But, you know, I did it again. It was a different scenario. I did completely awesome. I passed it. She was like, one of the best processes I've ever seen. I'm glad you didn't get into your head this time. But that was definitely like a confidence, what's the opposite of booster? Like, shot me down for sure. I was like, cool, skill 1 out of the 9 skills of the day, and I failed it. And I came back in and I didn't tell anyone, because I was like, I don't want to get them worried, and like, I can't be like, oh, I failed it, because you know, you don't want people to think a certain way of you. Anyway, I didn't say anything. I said, it's fine, take a deep breath, you know the information. Everyone passed everything for the whole day. I was like, cool, just me, awesome. So then we had our medical assessment, which I did great, but along with your medical assessment, you have to learn 9 different drugs. So just for the program, as an EMT-B, you have to know, I think it's 9, and have them right here, and this is how I studied them. But we can go through them really quick. It's aspirin, albuterol, oral glucose, epinephrine, activated charcoal, nitroglycerin, Narcan, Atrovent, and oxygen. And basically you have to know, I don't know if you can see what this says, but you have to know the trade name and the generic name. For example, for aspirin, the generic name is aspirin. Everyone knows what it is. And then the trade name would be Bayer. I don't know how you pronounce that, Bayer. Anyway, this one's oxygen. And then you have to know the indications. So basically, my patient is exhibiting these symptoms that indicate that you have to give them this drug. And then you have to know contraindication. Regardless of whether the patient is showing these symptoms that warrants this drug, if he is also showing these symptoms, then he's not allowed to get the drug. For example, nitroglycerin, this is something that you would give someone that is having chest pain, broadly chest pain. However, and obviously for any drug, if they're allergic to it, you're not going to give it to a patient. But if they have a significant head injury, then you don't give them nitroglycerin, regardless if they have chest pain or not. If they have used Viagra in the last 24 hours, you wouldn't give it to the patient. So that's where kind of like the detective work and the certain, like, you have to go through a set of questions to know what they're allergic to, what medications they are taking, and, you know, tell me about your pertinent past history, medical history, because you don't want to hurt the patient more already. They're already in pain. That's why they called you. So you know all of these drugs. Oh, I didn't go, what else do you need to know? Okay, so indications, contraindications, you need to know the side effects. So you give someone the drug and they're now having additional symptoms, like let's say a headache. You wouldn't want to freak out and be like, oh my God, this person is having a headache, when that's a normal symptom or a side effect of giving someone this drug. And then you also have to know the dosage. Obviously, you don't want to give someone too much or too little or kill them, because that would be horrible. And so they drill you. They ask you what the contraindications are. So even though the patient is having this, tell me exactly why you can't give them this drug. Or they might not say it at all. They might say it within, like, whenever you're getting their vitals. Like, certain vitals warrant not giving someone a drug. Like for nitroglycerin, if their systolic blood pressure is under 100, you cannot give them nitro. So they're testing your knowledge of what exactly you know. And then they also test your the dosage, how much are you giving them, and how are they taking it. Like nitroglycerin would be sublingual, which is in the mouth under the tongue. It's not, you're not like giving it to them in eye drops. So they want to know exactly what you know and how much you know, which is it's a lot and it's scary, but you can do it. If I can do it, you can do it. Anyone can do it. It's exhilarating knowing this much information. I've always wanted to go into the medical field, and it's slowly coming true. Then you also have to know the Glasgow coma scale. Basically, if you're watching a medical show, or if you're watching Grey's Anatomy, they're like, this patient has a GCS of 15. Like, what does that mean? You learn what it means. 15 is amazing. It's like the most that you can get. That means they have no dysfunction. Okay, once you have all of that done, this is going to be a long video, I have found out. So once you have your medical exam, medical skills, trauma exam, trauma skills, skills testing, you take your final exam. So the medical exam, the trauma exam, and then a couple of those chapters that happen after trauma, they go into your final exam. That's what I'm doing right now. I've been studying for the past couple of weeks. Some of the like procedures are now different because it's Corona, so I'm gonna end up taking it at home. So I'm waiting back from an instructor to make sure that I've done everything I need to do. She's gonna send me the password for the test, and I'm pretty sure it's gonna be proctored because we'd have to go in anyway. I've been using 2 different apps because I was like, how in the holy heck, I almost said holy heck and butt, but that's a Whitney Simmons thing. How in the holy heck am I going to possibly go over 41 chapters? But I just I just went into the App Store and put in EMT, and up popped these amazing apps with amazing reviews. I'll put on the screen what they're called, but this is what they look like. So that one and that one. I'm completely done. One of them has 800 questions, and I finished all 800. But it's just a bunch of quizzes. That's all it is. Let's see, I took 90 different quizzes, and sometimes there's 10 questions, and you can also make your own and make it 30 questions, but I went through all 800 questions, and their main subjects are airway, respiration, and ventilation, cardiology and resuscitation, trauma, EMS operations, and medical/obstetrics and gynecology. And then the other app that I use has practice final exams with 120 questions. I've taken 2 so far, and I bumped 14% from one to the other, so that is very reassuring. You need a 70% to pass for this final exam, and it's supposed to be practice for the NREMT, which you're taking at the end of the course. So if you're well prepared for the final exam, you'll be well prepared for the national exam. You need a 70 to pass, and I have scored well over a 70, so I am confident. So I will take the final exam, and then you do your oral boards. So much you need to do. So you go in for your oral boards. I still need to buy my uniform. It's basically just a polo shirt and then those really cool EMT boots and pants. But it's kind of like, from the videos I've seen, you basically go somewhere, you sit down, and they kind of go through a patient assessment. They want you, there is no skills involved. Everything is absolutely verbal. So if you're taking a step with your right foot, you're telling this instructor, I am moving to the right with my right foot. You have to tell them every single little thing that you're doing, just so they get a visual picture, because that's all that you can say. So they'll give you a scenario. I'm sure they give you multiple. They give you a scenario, 42-year-old female is presenting with this, what are you gonna do? So you're like, I'm in the ambulance and I'm going there, and then you tell them every single little thing that you do, but also you have to extract information from them. So you have to know the exact right questions to ask. You can't just be like, what are their vital signs? Because there's so much that go into that. You have to say, what is the pulse? Okay, thank you. What is the quality and the rate of this pulse? And then they'll tell you. So if you don't ask, they're not gonna give it to you, and that could be important to later, not diagnosing, but having idea with what's wrong with the patient so that you can treat them effectively. So then you go through your whole patient assessment, and then you say, I'm done. And then you probably have a couple, and then they pass you or they fail you, but I hope I pass. And then you have your clinical rotations. So I think in the state of Texas, you need 2 12-hour shifts in an ambulance and 1 12-hour shift in the hospital. I think they've changed it because of Corona, and you just have to be on the ambulance. But I'm interested in being an emergency room technician to get that experience to then go to PA school. So I'm hoping that even though it is not required, I can be like, hey, can I have a shift at the hospital just to get that experience? So then you complete your clinical rotation, and then so while you're there, you have PCRs that you need to fill out. Basically, it's basically paperwork. Who is this patient? What time did they come in? What did they present with? At what time did you give them medication? At what time did this happen? Basically stating everything word by word, sentence by sentence, event by event, just so that everything is documented, so that if something happens, you can go back hours later, weeks later, months later, years later, and you know exactly what happened to that patient, whether you were there or not. And then you finish your clinical rotation. And then you have, for this program, an exit interview and clinical paperwork that you have to get done. And then you take the NREMT, which is the national exam for EMTs. And then you're done. Well, we pass, and then you're done. So hopefully I answered any questions that you might have. There's obviously a lot. This program can take up to 6 months. I started in August. It is now the beginning of November. I know that says Happy Halloween, and I'll change it soon, but I'm going faster than like the average. They give you timelines of what students typically do and how long it takes them to do this or that, but I think I'll be done with everything, hopefully. I mean, I'm not in control of the clinical rotations. You kind of give them your availability, and they tell you when and where to go. So it's not like I can be like, okay, I want to do the 12 shifts 3 days in a row, let's get this popped out. And so I'm hoping I can take the NREMT sometime in November and then be done. I'll probably be done with everything in December. So that would be, what, 4 months it would have taken me? September, October, November, December, yeah, 4 months out of the 6. And then I will apply to jobs, and life goes on. But I'm excited. I mean, this is my first step into the medical field. I want to go to PA. I want to be a PA school. I want to be a physician assistant. So I'm glad to finally get the show on the road. I hope I answered everything that you might have been wondering about being an EMT student. If you have any questions, please comment down below. Don't forget to like, comment, subscribe, ring the little notification bell. English is hard. I hope y'all have an amazing day, and I'll see y'all next time.